The new COVID-19 boosters are now available to the public, but many Americans have a lot of uncertainty about when do I get it? Is it best to get it with the flu shot? What do I do? I mean, there is no book. We've been trying to figure this out. That's why we're bringing in Dr. Kohli to talk about this because, well, we've done it.
Yeah, but it was interesting because Pfizer specifically has that campaign with Kelsey talking about, get them both at once. They're saying get them both at once, and you're not so sure that that's necessarily the right thing for everyone.
Well, they've been studied together, the COVID and the flu, and thankfully the efficacy is very good together. Now, some people may have more reactions if they get them at the same time. So you really have to think about how you sort of responded to COVID shots in the past, how your body responds to flu. And if you're over 65, you're going to be getting this high-dose flu shot this year, which has an adjuvant in it, which stimulates even more of an immune response. So that may be a consideration in terms of spacing them out. What I'm hearing a lot of patients tell me is that they're waiting until November or December because they want to have peak antibodies for Christmas travel or for Thanksgiving travel. Oh. Now that's a mistake.
Yeah, you don't sound like that works for you.
No, and so it's true that your peak antibodies are about 2 to 4 weeks after you get boosted, but they don't just go away after those 4 weeks. You actually have a plateau, so they sort of sustain until about 4 months when you start to see decrement in the antibodies. So if people actually want to time it perfect for holiday travel, now is the time to get it. By Halloween, you'll have peak antibodies and you'll keep them through the Christmas time.
That makes sense.
Yeah, I'd also seen some people are having trouble finding the COVID boosters. Yeah. So that also, when you wait, sometimes you may be waiting longer than you
really regret
expect.
that, yeah.
That's exactly right. And if you wait too long and you get infected, as we know COVID activity is going up in wastewater and such, then there's no point because you didn't protect yourself.
So we'll go back to the same thing. Pfizer, Moderna, which one do you like? How do we choose? And do we ask the pharmacists?
Yep, so there are differences between the two. So they're both also similar, but different. So similarities are that they're monovalent. They both have XBB coverage. They're both messenger RNA vaccines, which we've talked about that technology before, but the dose is very different. So Pfizer has a 3 microgram dose, and Moderna has a 25 microgram dose of the same messenger RNA.
That's 8 times as much.
Yes.
Is that 8 times as effective, or 8 times more powerful, or just 8 times larger?
The problem is, Tom, they haven't been compared head to head. So we've compared them compared to nothing, and we've seen good antibody responses. So we don't know in the same individual would that translate into a difference in efficacy or not. Sometimes some people have more reactions to one versus the other. Generally, a higher dose, just like with the flu shot, elicits a higher reaction with more antibodies. But whether that translates into more clinical protection is unknown. But there's a huge difference in dose here, and that's what I find surprising as a scientist.
So how do you know which one you want? Because usually, at least I found you pick which one you want well before, like when you make an appointment or something, you're saying, I want Pfizer, I want Moderna. How do you know?
I think they're about the same, but given the higher dose vaccine, if you wanted to get more of an antibody response, you might get that with the higher dose vaccines such as Moderna as opposed to Pfizer. But if you've been getting Pfizer all along, you want to stick with that family, that's totally safe as well. Just make sure you go and get that vaccine. Now, what's interesting also is when you get that vaccine in terms of time of day.
Oh,
because I saw that question. What does that mean?
So this was a study that came out last year. They looked at UK health workers and they looked at what time of day. So if you think about our immune system, it follows a circadian rhythm. And it's actually maximal when we're sleeping. So if you go in the afternoon to get your shot, that means that's really going to sort of kick in most when you're sleeping, and that's what the study showed, that those individuals actually had a higher antibody response.
So it's like a happy hour, shots.
That's right.
Shots after work.
All right. Well, that's so interesting. Although I must say, I have seen people in local pharmacies a couple of times, including today, and it made me feel good to see people lined up trying to get a shot. Because I know there's so much controversy about this. I'm always like, well, good for you.
Yes, and we're now calling them COVID vaccines, not boosters, because the trend here is to sort of shift away from a booster. It's an annual vaccination. And if you're trying to think about, you said after work, Tom, when is the right day to get it? You probably want to go either on a Friday or a Saturday, because that peak sort of side effects kicks in about a day to a day and a half. Yeah. So
Friday happy hour.
Friday happy hour.
That's again what you're saying.
But do not mix with alcohol, just to be clear.
Well, we're adding RSV into the mix now, so I want to ask you about that in a second. But first, Do we know anything yet about the flu efficacy? Because some years the shot's very effective, some years not so much. Do we have any clue yet as to how this shot is working?
Looking at the Southern Hemisphere, probably about similar to what we've seen in previous
Average.
years. Yeah, about 30–40%-ish, which again doesn't sound perfect, but it's not just the infection. It's also if you get the infection, the intensity of symptoms, the duration of symptoms is a lot lower.
People 60 and older are also being told now to get the RSV shot. But you're saying you have to build that into a calendar to go with these other shots too, that it's important that they are spread out how far. So flu and COVID you can get even simultaneously almost.
That's right.
So but RSV you need to separate.
Right. So flu and COVID have been studied together, one in each arm, same arm, a couple inches apart. But the RSV is so new that it has not really been studied with COVID especially. It has been studied with flu shots. We don't know how the efficacy and safety work. So in general, most health experts and state departments are saying to space it out by 2 weeks. So either go RSV first, wait 2 weeks and get the other two together, or the opposite pattern. And for most people over the age of 60, that's seeming to work very well.
No problems, but that's out of an abundance of caution because we don't have research behind it.
That's right. I'm not really recommending to most patients to get all three together because we don't know, especially the three of them together, how they would affect the body.
All the more reason to do the first two now or whatever. And
Friday happy hour, that's when you do it.
Okay,
We
well,
can-
not
Dr. Kohli's
happy
advice.
hour. She just scolded you on that. No, okay, I'm listening.
I think that's what she said.
A different kind of happy hour. Vaccine happy hour.